There are several different types of pediatric scoliosis. It's a genetic disorder, so depending on how many genes you have, depends whether or not you'll end up having scoliosis, whether or not you have to be braced, or whether or not it requires surgery. About 3% of kids have scoliosis, but only about 0.1% of those actually is bad enough where we have to do surgery on them. It used to be that schools did screening, and so they would have every year kids, usually between the ages of 12 and 14, they would do school screening. That stopped about 15 years ago, and so it was really left to the primary care physicians to notice whether or not a child has scoliosis. As a parent, what you can do is you can look at your child's back. Are their shoulders level? Are their shoulder blades level? If you have them bend over, is one side of their ribs higher than the other? Those are some really easy things that a parent can do. Once I see them, we'll do a couple of different things. One is I'll physically examine them, look at their back, and oftentimes we'll get an x-ray on our EOS Edge x-ray machine. It's a specialized scoliosis x-ray machine just for kids. It has 80% less radiation than a regular x-ray machine. We're the only practice in the state that has it, and it's a great way to really diagnose and then to follow the kids. If they do have scoliosis, we'll usually see them about every 3 to 4 months just to check to see if it's progressing or not. Most children, when we first see them, we're usually able to just follow. If the curve gets between 25 and 40 degrees, we'll often talk about a brace. And it depends where they are with regards to skeletal maturity. If the curve gets somewhere between 45 and 50 degrees, we start thinking about surgery. As soon as I bring this up, I usually see that I need to bring the tissues out. Moms and dads get teary-eyed, the kids get teary-eyed. And what I try and let them know is, yeah, you're gonna have a surgery, but it's something you're going to recover and be completely normal afterwards, and you'll have a completely normal life. I've developed a scoliosis clinic every other Friday where we try and focus really on kids. I think kids feel better being around other kids who have the same problem. There's a company out there that makes these little bracelets, and there's one that's in support of the Scoliosis Research Society, and I buy them for all of my kids. All of my kids who have scoliosis, I give them a present and I say, hey, you're part of the club. And I think the kids in the waiting room, when they see other kids with the same bracelet, they know they're not alone, that other kids have the same thing and they're going to be fine. Just ecstatic that it's taking off and we have all of the cutting edge equipment we need to take care of these kids.